and welcome to Medical Dialogues. I'm Dr. Bhumika. Here is what I bring to you from the world of medicine. Empathy-focused phone calls may control diabetes in low-income adults. Empathy-focused phone calls made by trained non-medical community members led to significant improvements in blood sugar control for low-income adults with diabetes, according to a new study from Dell Medical School at the University of Texas at Austin in collaboration with Lone Star Circle of Care. The study was published in JAMA Network Open. The research suggests this approach could provide a simple, cost-effective model for managing chronic conditions, particularly for patients with limited access to traditional mental health and support services. During the 6-month clinical trial, 260 patients with uncontrolled diabetes were randomly split into two groups, one receiving only standard care and the other receiving both standard care and regular calls focused on listening and empathy. These calls were made by community members trained to provide compassionate support, enabling participants to share their experiences and challenges in living with diabetes. This approach begins by acknowledging the real-time and everyday challenges of living with diabetes, said Maninder Mini Kalon, PhD lead author of the study and associate professor in the Department of Population Health at Dell Med. By offering genuine empathetic support, we had an impact on health that's the clinical equivalent to taking medicine. That's because emotional well-being is the gateway to the lifestyle changes that improve management of the condition, an area where traditional healthcare often falls short. Key findings include: number 1, improved blood sugar control. Patients who received empathy-based calls saw an average HbA1c reduction of 0.7% compared with no significant change in the control group. Number 2, greater impact for patients with mild or greater depressive symptoms. Patients reporting mild depressive symptoms saw even larger reductions with average HbA1c improvements of 1.1%. Number 3, high satisfaction. Nearly all participants receiving the calls rated them as very or extremely beneficial to their well-being. Participants were all Lone Star Circle of Care patients, were given flexibility in frequency and duration of their calls, allowing them to choose 1 to 5 calls per week during the initial stages and tapering as they progressed. This patient-driven approach empowered individuals to receive support at a pace that suited their needs and schedules, fostering a strong connection with their callers and reinforcing self-care routines. Thank you for watching Medical Dialogue. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.